Thanks so much for having us.
Yeah, we really appreciate you guys letting us in here and kind of give you guys a little spiel on how we can be a resource for your kiddos and help support language development at home. So a little bit about who we are. My name is Amy. I am co-owner of Expansion Speech Therapy. On the right there in the picture is my business partner, Casey. She's also a speech language pathologist and does specialize in feeding and swallowing picky eaters and problem feeders. And then this is Jamie. I'll let her introduce herself.
Hi, I'm Jamie. I'm our lead SLP. I, alongside with Amy, specialize in augmentative and alternative communication. Primarily our practice sees kiddos from birth to 21, but we are starting to get into our 20s and 30s as well. So today we're going to kind of focus on that school-aged language development. So this is a little bit more about us. Expansion Speech Therapy, or a pediatric speech therapy practice. We offer individualized treatment for families and their children. Individualized intervention is our expertise, and family and team involvement in therapy is vital to your child's growth and success. Together we can expand a child's communication, feeding, and play skills.
And to kind of go off what Jamie just said, like part of our practice is we're here to see and meet the child where they are. If they need help in school, if they need help at home, caregiver education, support, and all of that. So I'll also went right into it. So we have an office in Fort Washington, Pennsylvania, but both Jamie and myself live in Philadelphia. So we see all of our Philadelphia kiddos. We also see kids on the main line as well. So we cover a wide area.
Okay, so what is speech language pathologist? We work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders through the lifespan.
Some delivery areas. So there's a lot. There's about 8. Speech, stuttering, voice, language, social communication, cognitive deficits, feeding, swallowing, and AAC. AAC, just so you guys are aware, are for our non-speaking kiddos who need access to communication. So think an iPad with a communication software.
Where can you find us? Everywhere. We are in private practices. We might be in physician's office, hospitals, school settings, college and universities, rehab centers, long-term care. So we're going to kind of dive into each of the areas a little bit more and then talk a bit about milestones and then some kind of things to be looking for during that childhood development.
And we definitely want to be open to questions at the end. Okay, so speech sound disorders. They occur when a person has difficulty producing the speech sounds correctly. So stuttering is a form of disfluency or has problems with voice or resonance. Language disorders are a receptive language, so our understanding of language, following directions, and then our expressive language, so verbal communication. And also language disorders can be spoken or written, and they involve a variety of other areas that fall into speech, as well as some pragmatics or social communication.
Social communication disorders occur when a person has trouble with social use of verbal and nonverbal communication. These disorders may include problems with communicating for social functions, so social greetings, participating in a reciprocal conversation, talking in different ways, right, when we kind of have to code switch when we're chatting with a teacher versus our mom versus a friend, and then also following rules for a conversation or a story. Our cognitive communication disorders is a whole lot of our executive functioning difficulties, so that is problems with organization, attention, problem solving, planning, etc.
So feeding disorders include problems with sucking, eating from a spoon, chewing, drinking from a cup, maybe picky eating, if there's like a really small repertoire of food that a child will eat and how to expand that. The swallowing disorders or dysphagia or difficulties with moving food or liquid from the mouth down into the stomach.
And AAC, so this means all the ways that somebody communicates besides the use of our spoken language. Some people might use this throughout their lifespan. Some individuals use it for a short amount of time. Pretty much I always say if our verbal speech is not effective and efficient, and we can't be independent in using it 100% of the time, that's when something like AAC is introduced.
Okay, so now we talked about a lot of the areas. Now we're going to go into the milestones. Okay, so by 12 months, we're going to go over a few different things. We also have some resources and handouts that we're going to send home with you all. So 12 months, responding to simple words, phrases like go bye-bye, look at mommy, saying 1 to 2 words, right? By 18 months, we're following directions. Give me the ball, maybe paired with a gesture with an open hand. Understands and uses words for common objects, some actions, and people in their lives. Then we get to 19 to 24 months, we're using and understanding about 50 different words for food, toys, variety of different things. Speech may not be clear, and that's okay by then, as there are some articulation milestones that you're also looking at. Some kids may not have R until the age of 5, and that's okay. Also, we like to say, here are milestones. Every child is different, and they may hit that milestone later, and that's okay.
By 2 to 3 years old, we're going to see some kiddos starting to use word combinations. They're going to be repeating a whole lot of what we're saying. They're going to be trying to figure out, they're probably not going to have any grammar. We're going to be trying to figure out how to combine words. So baby, baby sit down, I want, juice drink. And they're going to be starting to combine these words for a variety of what we call pragmatic functions, right? So not just to request, but we might start hearing this age group ask questions or demand things, right? Or comments on things that they see in the environment. Again, between 2 to 3 years old, our speech, the clarity of our speech sounds should get a little bit better, but it's still not going to be 100% across all listeners. Again, some of those sounds still might be working their way into the repertoire, but it should be getting a little bit easier to understand across partners. Then by 3 to 4, we should see definitely a bigger explosion of language. We're going to be seeing our little guys start to tell stories, maybe recall things from the day at school, understanding and using words to compare. They might start using prepositions, more describing words, and that sound clarity should be getting better and better. And then by 4 to 5, we should definitely see more grammar markers and sentences of increased length and complexity. And they're going to be understanding a whole lot more about more complex concepts, like, for example, time, like tomorrow we're doing this. And again, our speech clarity should be getting better and better. Oops. Oh, well. Okay. So that's kind of the milestones. So here's some kind of things that we wanted to highlight that can kind of be looking out for. Again, as Amy said, every child develops so differently. But you guys are the parents and you know your child best. So if you feel that they're not meeting some of these milestones, we would always rather you call speech OT, PT sooner, so you can get an evaluation, talk these things out, and kind of make a game plan from there to see how to best support their development.
Yeah, we always say trust your mom or dad gut. If you feel like something is a little off, it's never going to hurt to call and ask those questions versus wait and have something kind of linger for a little bit longer. So kind of this is just reiterating all those things that we just discussed in areas. So speech sounds is something that's really important. You should have certain speech sounds at a certain age. That you're speaking clearly, our language and literacy, if kids are having understanding what they're hearing, so really understanding the spoken language and the directions that they're being given, the social communication, having trouble talking with their peers, that's such a huge thing coming to school, right? Like, how do I interact with my peers? How do I initiate play if they're struggling with that? Or the cognitive communication, so the thinking skills that they need to remember to problem solve, imagination, and learning disabilities and brain damage can obviously have a huge effect on these areas.
Feeding and swallowing. So this is going to kind of be seen at home and school. Again, sometimes we're going to see kids that are just very picky eaters. Sometimes this is going to pass. Sometimes we might need some support from a speech therapist or an occupational therapist to come in and do some problem solving with the family. Sometimes some kiddos are having difficulty with their chewing skills, with their swallowing skills. So that's something too that you would see at home or at school. Stuttering, again, sometimes we're seeing our little guys who, when we're having a language explosion, we're going to be repeating ourselves over and over and over and over and over again. But if some of those disfluencies persist past a certain age, then it's definitely something that we can kind of come in to support. And then again, voice. So sometimes children might sound hoarse or nasally, talking too loud, talking too softly. This might be really challenging, especially when they're in the school environment. So if you're noticing any of these difficulties, it's definitely beneficial to talk to a teacher or talk to one of the therapists to kind of troubleshoot what's going on.
Okay, so some of the impacts of communication breakdowns. You obviously need language to communicate, receptive and expressive. You need to communicate to learn, reading, writing, gesturing, listening. All of these things are going to impact that child. If you know a child who has a speech and language problem, they might not be able to do grade level work, so we need to teach them those skills in order to get them to that next level. They may not have understanding social cues, so this is all kind of what we've already gone over. If they're having deficits in these areas, it's always great that we are here as a resource, and OT and PT if necessary.
Okay, so we have some handouts as well to share with everyone, but we just wanted to make sure we're going to give you guys handouts for kind of everything we discussed. We also wanted to give you guys some strategies and some helpful tips and tricks for home to be able to support in that language development. So we're going to hand these out, but some of these strategies at a glance, I think the biggest one that we're always reminding people is to reduce the questions. I think it's very challenging as parents, as therapists, as teachers, to not ask questions. We're asking questions all day. Like, how was your day? What do you want to eat for snack? Where should we go after school? Sometimes our kiddos, whether they don't understand that WH question, whether they have yet to learn how to respond to that question, right? Whether maybe they can't remember what they ate for lunch at school today. Maybe their memory is like, shot after a long day. We always recommend reducing questions, and instead we work on commenting, narrating, naming things that are going on in their day, so we can kind of bombard them with that language to then long-term have a better understanding of how to answer a question.
And a good strategy for that too, I always tell parents, is like, if your child struggles to answer that WH question from like them reflecting on the day of what they did at school, give them multiple choices. Did you go outside? Did you eat pizza? Like giving them some options of what they did so then they can successfully have that interaction with you.
Yeah, absolutely. So like giving choices, using gestures or signs. So even sometimes we'll recommend parents, have like a visual from like at the end of the day at school. So like, what did you do today? Did you go on the playground? Did you have music class or did you have art class? So they kind of have those choices, and they also have some like multimodal strategies that they can utilize to best answer those questions. So we'll give these out so you can kind of see these in a little bit more detail, as well as some additional tips and tricks. So again, this is another, if you want to hold one of these, I think the biggest one on here that we always remind people is the don't say. We're always like, okay, say please, say thank you, say hi, say this, say that. Our children are just going to kind of parrot that. We want them to be able to learn language in the most natural way. So again, we really try to avoid being super vague and give them really explicit instruction on how they can best learn and develop some of these communication
Autonomy,
skills.
spontaneous communication.
Yeah, absolutely. That autonomy and independence is key.
Another good one, so avoiding correcting a child's words directly all the time. It may frustrate them internally and have them shut down, right? So it's always nice to get on their level, give them time to express their thoughts, and really listen to what they have to say and kind of divert the conversation to meet them where they are, always.
Okay, so we kind of blew through that, so we want to make sure we have time for questions, if anyone has any. Yeah.
I like to correct grammar. Miriam went to the play dance today. I said, Miriam and I went to the play dance today. What do you suggest for correcting grammar?
No, that's great.
That's,
like that,
what you just
call
did.
it like the recast. So right, instead of the like you're supposed to say this, I would just recast it right back to her with that correct.
With the correct grammar.
Especially the pronouns are like the hardest thing. Everybody mixes and matches because again, for her whole 6 years of life, she's heard someone chatting with her, right? The like, you're going to do this, or, so now that she's able to express those things, it's very tricky. Like, that's very typical. So I would just keep doing what you're doing.
And it should naturally fall in, and she should be using that correctly moving forward. Just give her some time, but continue to do what you're doing. Yeah.
We just exactly what you described. Yeah, just model back to them.
of saying, say thank you.
Mhm.
Say thank you to the person who's model behavior.
Yeah.
Yeah.
You don't do, should I say Wednesday?
You can say that. Like,
Yeah,
for
like-
politeness, typically, we don't automatically teach those right away. We encourage use of polite language, right? Like, we want our kiddos to use that. But typically, as speech language pathologist perspective, we're working on, like, the hard language of, like, how can we get their wants and needs met in the best way.
Mhm.
So what do you say is fine?
Yeah.
Yeah.
Mhm.
Exactly.
Yeah.
Politeness and
Yeah. Yeah. You can always encourage it. And, yeah, what do you say I think is totally appropriate.
Mhm.
Yeah.
R's the hardest.
Is she saying W for R? Uh-huh. Yeah. Uh-huh. Mm-hmm.
Yeah, Amy can come help. I joke. I don't. That's
Ours
R's
is
are hard.
R is hard.
So R is hard because it can either be by itself at the beginning of a word, right? Like a word like red, race, or it can be anywhere else in the word next to any given vowel.
And think about all the different R's. There's
And
ER,
with any
AIR,
vowel.
AR. There's a lot of different
OR,
R variations.
and they're all going to
trick?
sound different.
You can try this trick. It's silly, but I'm sure your daughter. So one of the things you really have to target is kind of pulling your tongue up and back. Is made all the way back here, and sometimes kids, their tongue stays it's flat. So something that I do with my kids to discuss where your tongue should be is we look in the mirror and we talk to each other, and we don't open our mouths. Because your tongue will naturally go back that way, because your tongue really has to be working in the back. And that's something where we start. I like to notice that, really engage them that way too, because they think it's funny. But you're really still targeting something informally. Yeah. But definitely 5 is right around when you should get R, but it's 6. They recently changed it and upped it to 5. It used to be like 6, so. Great question.
Great question.
So expansion, our practice is private pay. There are speech therapy providers that do accept insurance. For us, we send our families super bills, in which you can then submit to your personal insurance for partial, full reimbursement, depending on what your out-of-network benefit may be. So that's what we do, but there are other providers and organizations that do accept insurance. For us, speech sessions, depending on a child's age, typically are 45 to 60 minutes. Let's say the kiddo is super young and attention is not there yet, we'll do 2 30-minute sessions. And it all depends on the kiddo's needs. If we do an evaluation and they can be seen in school and we can communicate with parents at home, we can do that. If there needs to be extra attention in the home, we can also do that. We're very transparent about whatever the child needs is how we'll create our plan of care. Yeah.
That's part of it. You mentioned the outset helping parents.
Mm-hmm. Mm-hmm.
I also see this in a clinical setting.
In the outpatient setting? Yeah.
Mm-hmm.
So I'm wondering, how is this?
Mm-hmm.
That was my first question.
It's a great question.
Yeah, the best question.
So
Yeah.
There's a lot of questions about integrated therapy at home. I want to help parents with that question.
Yeah. So we're
So
probably going to
that's
say the
called
same thing.
generalization of skills. You learn one thing in one place. Can that child then take it home and do it? Or we still have that barrier, and that goes with a setting. So school, home, community, or people, unfamiliar communication partners, family, whatever that may be. So yeah, we usually, if they're doing great with us at home and maybe not carrying over the skills, we'd love to call a parent, or if we're able to meet a parent and show them what they're doing and have you join in the session. That's how we kind of operate.
And we also, are pretty, again, flexible in our, if something's working at home, but we're still seeing it not working at school, we'll try to go to school. If it's working at school and it's not working in the community, we try to go into the community. We always were very big on having families involved, and actually all of us at at Expansion, we all were previously in outpatient hospital settings, so we definitely have that understanding of.
And that's the reason we started the practice.
Yeah.
How a kid learn something in a sterile environment, a room in an outpatient setting, how do we generalize those skills?
Mm-hmm.
So we can talk about it more depending on what your child is working on. A good strategy might be like, hey, can I sit in on the session today and go in the room and see if you can elicit if it's speech sounds or whatever it may be. Yeah, there you can go online. There's a lot of virtual resources that we can provide to you if you're looking for that, depending on your child's area of need.
Yeah. And again, we're pretty flexible, and I know we are, being from the outpatient setting and now doing the private practice, we're very understanding of right. We don't ever want anyone to feel like, oh, we're just going to speech and then we're home by ourselves. So we're kind of constantly communicating with not just parents, but teachers, OTs, physicians, nutritionists, dietitians, the list goes on, because that ensuring that there's generalization and then that like continuity of care. So we can definitely give you some additional resources. Okay, great, thank you.
Thanks for having us, guys.
Good morning. My name is Amy Peterson, and I'm an occupational therapist. I own Practice Play OT. Have been an OT for a long time, working in hospitals and with the IU. And after many years of doing that, I would be in different classrooms and see children struggling, and I'm like, and the faculty's like, they don't get any services. They missed it by 3 points, and my heart just really bled for these kids who, like, maybe they need 6 months with an OT, maybe 6 sessions. They need some strategies. So that's kind of how Practice Play was started. I started doing small groups at our community center. I live in Haverford Township, and then started growing from there. So I see primarily children out on the main line, and Elizabeth sees a lot of the Center City referrals that we get here at Greentown and some other schools, and we service children in the school and at home as well. A lot, like, to piggyback off of what you're saying, is going where the issues are happening is primarily where we see best results. So it's not just like in a silo, particularly with occupational therapy, where it's like your occupational roles, and for a child, a big part of their day is being a student and a friend and a community member, along with being a family member as well. So we're happy to be here today. And Elizabeth put some beautiful slides together for some information on occupational therapy and early development.
And I'm Elizabeth, and I've been working with Amy for, I think, 5 years now. And I also have experience in early intervention, hospital settings, and the community. So what is occupational therapy? As you will see, we address just not everything. It's really fun, but really, like, our main focus is supporting engagement and participation in daily living activities, which we call activities of daily living, education, work or play at this age, leisure, rest and sleep, and that social participation component. And we really like to use a holistic approach to work with children to address kind of those underlying physical, cognitive, sensory, social, emotional needs to promote overall well-being and independence, especially in the school setting, and really using a personalized approach to reach developmental goals and milestones through play, actually. So kind of our main focus of like early intervention, kind of piggybacking off of what was mentioned earlier, is the first 5 years are a really critical period of brain development. There's a lot of research out there about how important and how beneficial intervening early can be. It's more effective when it's provided earlier in life. And studies have shown that intervention can significantly improve long-term outcomes in children who do happen to have developmental delay or disabilities. But really targeting skills early on can change a child's developmental path and really improve the outcomes in all settings. So we're really big proponents of, again, having that intuition that I think something is not right, reaching out because we can make such a bigger impact early on than maybe when the child is 10, 12, what may. So what do we address? Like I mentioned, we cover a lot of things. So motor skills, fine motor, gross motor, Physical therapy addresses that a lot too, but a lot of the OT skills, they have underlying gross motor strength components, so we are addressing that as well. Visual motor skills, cognitive skills, specifically executive functioning and memory, usually for some of those older kiddos. Self-care, usually what we're looking at is dressing, eating, grooming, sometimes sleep, nap participation, and then sensory processing. We are really skilled and trained in identifying needs, creating sensory diets, and providing those school and home supports. So we'll dive into some of the main areas that we really address more so in the school setting with some of those school-aged children. So fine motor skills is the ability to use those small muscles of fingers and hands with appropriate strength and coordination to be able to grasp and manipulate objects. Obviously, fine motor skills are very different for an 18-month-old and an 8-year-old, but usually kind of the main components of fine motor skills are grasp, release, object manipulation, hand strength, bilateral skills, so using our hands together, and then tool use, so pencils, scissors, tongs, those kinds of things. And then just quickly kind of going over those typical fine motor development. There's all those CDC charts and developmental milestones out there, but I kind of put together the ones that we specifically are looking for with an OT lens, and then just kind of being mindful that yes, everybody progresses and meets milestones at different times. However, as occupational therapists, we really focus on making sure that there was that progression of milestones, because usually these early skills are foundational to be able to have those or later skills and to have them like appropriate. So, the ability to write letters, if you can't make a circle or draw a square, it's going to be really difficult to be able to do handwriting later on in life. So just quickly, kind of that 18 to 24-month-old range, we like to see scribbling, being able to stack towers, turning pages in a book, and having a nice pincer grasp. So that thumb to index finger. Usually that preschool, 2 to 3 years, being able to string beads, stacking a tall tower, being able to open containers and imitating those free-writing strokes. And then as we get a little older into preschool, starting to imitate circles, putting on scissors, snipping a piece of paper, having a more of a dominant hand should start emerging around those 3, 4, 5 years old, and a more mature pencil grasp, which I believe I have on this slide here. So this is kind of a nice development of grasps. So again, kind of that 1 year age, you should have that nice pincer grasp. And as the child progresses, eventually by kindergarten, first grade, we really should have that nice dynamic tripod by 3-finger grasp. Typical fine motor skills for those older kiddos should be able to cut simple shapes, coloring within lines, having that mature pencil grasp, being able to draw pictures that are recognizable, being able to draw a person with appropriate features, facial and body features, being able to print and their name and write letters, and then as they get older, 6, 7, 8, writing consistently on the lines, writing most of the letters properly. And hand manipulation skills, which we'll go over in another slide, being able to lace, thread small beads, and we really should have an established dominant hand. As you may have noticed, I don't have a dominant hand listed until 3, 4 years. Really, up until 3 years old, a child should not have a dominant hand. They should be fluidly using both hands. They should be able to use 2 hands together, and not until they truly are starting to do some of those pre-writing, pre-handwriting skills should that dominant hand emerge.
Sometimes you'll see too, like with those like 5, 6, 7-year-olds who are like haven't had a hand dominance established yet, like they have decreased ability to cross the midline of their body, so they'll like write with their left hand across the left side of the page, switch to the right. So it's interesting to just kind of see how the left and right brain are communicating to each other or not. So even if you're seeing some of that at home too, and they're a little on the older side, just trying to do some like cross-body movements, like prior to writing tests, kind of starts to get the brain talking to one side to the other. So those are some little tips that you could do too at home if you're kind of, seeing that in some older children, a lot of switching, just trying to do more cross-body movements, and also just offering the writing tool in the midline of the body, like where are they initiating the task with, like take this bottle top off, or just not always like putting the fork on the left or whatever, just offering things in the midline, just kind of see what's the pattern, where do they go for initially.
And that kind of goes back to that underlying, looking at the underlying skills that are needed for handwriting. So you need to be able to cross your midline, which is the gross motor skills, to be able to do handwriting, but it all is intertwined and they all build off of each other. And then some of those in-hand manipulation skills for those older kiddos. So finger to palm translation, so being able to pick something up and hold on to it in their palm. And then being able to do palm to finger translation, so being able to have a couple coins or a couple beads in their hand and being able to push it to their fingertips one at a time. Shifting, being able to turn pages in a book. Simple rotation, being able to open up lids and containers, and then more complex rotation. Again, that'll be more of those first graders being able to rotate a pencil from eraser to tip without using that other hand to assist. So then we also have visual motor skills, which kind of go hand in hand with those fine motor skills. But this is the ability to coordinate visual information with physical movement. So children use these to guide their actions, supporting everyday tasks and learning. So hand-eye coordination, spatial awareness, really precise fine motor control. So that would be handwriting, coloring, mazes, dot to dots, those kind of things. Visual perceptual skills, pre-writing and handwriting skills. And visual perceptual skills, those are kind of like underlying skills of handwriting. So like, trying to think, like visual discrimination, visual memory, really, there's a lot of components to it, which can impact the child's ability to have strong visual motor skills. So again, kind of that early development. So we're looking for the ability by 3 years old to be able to copy patterns with blocks, building towers, imitating those pre-writing strokes, being able to copy a circle and snipping with scissors. At preschool age, cutting a paper in half, copying a cross, copying a square, copying more, or cutting simple shapes, being able to color inside the lines, and being able to fold a paper in half. And then as we're getting more into school, first, second grade, being able to write their first names. Again, drawing basic pictures and forming letters and numbers correctly, and being able to write on the lines. So it does look very similar to those fine motor skills, but they all are intertwined. So some things to look for under 5 years. Really biggest thing is not meeting some of those milestones, having those immature grasping patterns. So maybe you have a 2.5-year-old and you notice they're picking up their Cheerios like this, and they're still using a whole fistic grasp. Maybe they already have a really strong dominant hand, and you notice, like Amy said, whenever I put the box here, they're picking it up like this, and then giving it to their other hand, and they're not crossing their body. Excessive drilling, so working really hard to do some of these more challenging tasks. Just noticing overall, like the arms and hands. Sometimes we get they're 3, 4, and they say, I'm tired, my arm hurts, and that's a big indication. Okay, we need to work on something, because you shouldn't at 4 years old be complaining that your hands are tired. And then jerky or uncoordinated movements, and just overall avoiding these activities, avoiding things that are tough. And then some things to look at when you're over 5 years old. Again, not meeting some of those milestones. Probably the biggest indicator at this age is that handwriting, that we're just not getting our letters right. We're not able to cut, perhaps. The grasping, we don't have a tripod to get grasp. We don't have a dominant hand. Handwriting is really messy. Or perhaps handwriting is, they're ripping their paper because they're pushing so hard on the pencil, or they have really light handwriting. That can be a strong, that can be an indicator that perhaps there's some fine visual motor things going on. Again, avoiding these things, like I don't want to do handwriting, saying handwriting is terrible, those kind of things. And then also, which we'll talk about And a few more slides, difficulties with those self-care dressing tasks. So, usually by 4 or 5 years, we're a little bit more independent. We're able to take our clothes off, put them back on. And then a sign that when those skills are challenging can be a sign that perhaps, again, there might be some fine motor, visual motor things going on. And then poor ball skills, not being able to catch a ball, not being able to throw a ball, not being able to get into a net might be an indicator that there's some other things going on. So ways to support skills at home with those younger ones, playing with blocks, sorting things, stringing beads, playing with Play-Doh and Play-Doh tools. So giving them those plastic Play-Doh fork and knife or scissors, just getting them used to manipulating those tools. Using broken crayons to support proper grasp. So perhaps you have, a 3-year-old who's still holding a crayon like this, break it in half, and they have to use their fingertips to manipulate it. So little easy ways to do that. Squeezing things, squeezing little like eyedroppers, sponges, spray bottles to strengthen those hands. Sticker play, great way to promote a pincer grasp. Doing wheelbarrow walks, animal walks to strengthen the shoulder girdle, strengthen the hands, ripping paper. For some older kiddos who maybe we notice they're having some challenges with handwriting, doing and coordinating their use of their pencil, doing mazes, doing color by numbers, doing connect the dots, doing puzzles, and not only for the fine motor aspect, but can they look at a picture and put all the pieces together to imitate that picture? Playing I Spy, playing catch, and threading and lacing. So threading, like putting beads on a string, lacing, kind of like that young like sewing motion. Anything?
No, these are great. Yeah.
Perfect. Okay. And then another area that we really like to address specifically in the school setting is some of those cognitive developmental skills. So executive functioning skills, help regulate the flow of information and emotions, ability to maintain focus in tasks, and also prioritize what needs to be done and keeps us organized. We also address emotional regulation, so a child's ability to recognize, understand, and manage emotions in an appropriate way, and self-regulation skills. So ability to manage, these are very similar, but ability to manage emotions, tension, and behavior in order to kind of regulate themselves and meet the demands of the classroom and social environment. And I feel like we get a lot of kiddos that perhaps have strong emotional regulation skills in the sense that they know, what they know the emotions, and they know what the appropriate response is, but that self-regulation aspect, when they have those high demands and they're in those settings at school,
Yeah.
those skills
Feel it deeply.
yeah. So just a quick overview of some executive function development. So 1 to 2 years old, they're able to shift attention to new things. They're perhaps inhibiting some reflexive behavior, but consistently. Don't throw your spoon on the ground. Maybe 50% of the time they're stopping that action, and they are able to follow simple 1 to 2 step directions. So go get your shoes, go to the front door, those kind of things. In preschool, there should be some emerging impulse control, attention and concentration should be able to follow the step direction, and beginning to know the rules, beginning to know what is expected of them in that school environments and home environments. And then 6+, should be able to follow multi-step directions, learning from mistakes, and ability to switch between tasks, and that working memory emerges. So being able to do something and remember it as they are doing, so they can use that skill later on. And then simple organization of classroom materials emerge. So folders, backpacks, lunch boxes, those kind of things. And then a quick overview of that emotional regulation. So 18 months to 3 years old, they're starting to label feelings, asking perhaps for help to manage. And then 5 to 8, they should become more skilled, have a better control, are seeking out friendships, and are able to have some empathy. And then self-regulation development, again, about 1.5 to 2 years, becoming aware of social demands, are able to change behavior when asked. Preschool age, again, self-control, begins to follow rules and guidelines outside of the house as well. And then 5+, They should have a strong sense of self-control, follow needed guidelines, sense of fairness, and a conscience emerges around this age as well. And then things that we are looking for, and I just want to make a note that really, many kiddos may have difficulties transitioning between activities, but really what we're looking for is if that's consistent and really disrupting day-to-day life, that you really aren't able, to go to school, do the things that are important to your family and your child. So difficulty transitioning between activities, trouble waiting their turn, frequent outbursts or meltdowns, trouble focusing on tasks, really intense emotions, having really a tough time calming after becoming upset, or even just becoming happy. Sometimes just having a tough time coming down from strong emotions, and an inability to adjust your responses to different situations. Kind of that eye contact, that social aspect by 2 years old, and then falling behind peers academically, and usually we see that with those older kiddos. And then poor organizational skills with the older kiddos, again, they have a really messy desk, messy backpack, their homework is all over the place. Those might be some indication that there may be some executive functioning. And then self-care skills. So again, these are things that we love to address with this age group. Self-care skills are really essential for independence and managing everyday tasks independently. So feeding and dressing, grooming, toileting, sleep, on and on, whatever is important to that child. We are trained and skilled to try to help them become independent and meet those milestones. And the feeding component, I really go into it so much today, but we can address it not only from the ability of using the utensils, but the sensory aspect as well. So again, quick milestones. By 2, removing clothing, unzipping zippers, scooping food with a spoon, with spillage, trying to wash my hands and able to drink from an open cup and straw. Preschool, putting shoes on, using a fork and a spoon with minimal spillage, being able to, again, to remove loose clothing, brushing hair, and starting to manage fasteners and being potty trained. And then those older kiddos, they should be pretty independent, putting on their clothes, shoes on the correct feet, shoe tying. That's a big one. I know it's becoming a skill that perhaps is not addressed so much anymore, but yeah, really, children should be tying their shoes by 6, 7 years old. Totally independent with toileting, that includes like clean up, and then selecting appropriate clothing for the season, and cutting with a fork and a knife. So again, some red flags, resistant or sensitive to self-care activities, maybe difficulty chewing food or drinking from a straw or an open cup. Perhaps, if there's a 3 or 4-year-old still using a sippy cup. Sometimes we see kiddos who are still drinking from bottles at 3 or 4 years old. Increased spillage and messiness with utensils, finger feeding, sensitive to different textured clothing, and unable to manage some of those clothing fasteners as we get older, kind of that 5, 6-year-old range. And then ways to support that at home, practicing using oversized clothing, using those little dressing boards, family modeling, showing them how you get dressed, siblings get dressed, playing dress up, such a fun way, getting dressed up as different characters. And then kind of, where OT comes into play, identifying those underlying skills that perhaps are overall affecting performance. And then the last quick section we'll go over is sensory processing. I'm sure everybody's kind of heard that. It's a big buzzword, but it's the way our brain receives, organizes, and responds to information from our environment. And every child has different sensory needs. Every human has different sensory needs. So some signs that your child may have differences is poor frustration tolerance, behavioral outbursts, bothered by touch, avoiding messy activities, short attention span, poor concentration, unaware of their surroundings, poor safety awareness, mouthing non-food items, being messy and clumsy. And again, that's, children might demonstrate all of these, but again, if it's persistent and really impacting your day-to-day is when these become like a red flag. And really sensory rich activities and environments are key to success, so again, every child is different. That's why, we call them individualized, like sensory diets. Some kiddos might need, a sensory bed just to regulate, need some tactile input. Maybe they need some deep pressure, and all they need to do is, lay and bounce on a ball, a calming corner at home, doing heavy work. Activities can be really grounding for all ages, but it is very child specific, so it's hard to give
Specific,
yeah,
but
specific,
exposure.
but exposure. So really,
Yeah.
getting that child on the playground at a young age, giving them exposure to different textures, different sights, different sounds, so their body is able to learn how to process and regulate those sensory inputs. And really, so how can we help? We help by achieving milestones, providing adaptive strategies, and supporting independence. And we really, work with the family. Again, as mentioned before, we are in the school, in the home, working with, whatever caregiver is there on a day-to-day basis to support that child in the environment, in the area where they need it. Thank you.
Yeah, Elizabeth has to go see a shot, so. Thank you. Yeah, so we are as well private pay, and we do offer a paid in full super bill that, that we could provide, and it just depends on your carrier, unfortunately. I wish it was a better situation. But yeah, does anyone have any questions?
Just one comment is that it's so reassuring and affirming that the Green Towns program works on all of these skills in depth and isolating specific skills throughout the progression of the program, and that's because this is all about child development. We're all about child development. So anyway.
Yeah, and we've done
in-services. We're here.
Yeah, and we've all done in-services with the staff, so we're all kind of using the same language and can give strategies and are available for questions and things like that. But I think as far as referrals are concerned, it's like what Elizabeth was saying. When it's persistent and it's really like impeding their success or their friendships, and they're not able to participate fully, is when maybe you would seek out like assistance of an OT. I think that would be that. Yeah.
Is there a distinction that you make between occupational therapy and behavioral?
That's a good question. Yeah, I know. One of my good friends is a behavior specialist, and we talk all the time because I feel like they can be dovetailed. So it's kind of like what you really have to look at what the child is seeking and what they're trying to get out of their behavior. Like behavior is always communication, right? They're trying to tell you they don't like something or tell you that they want something, but if it's a more sensory-based thing where they're seeking out movement or they're reacting to how their brain is processing their sensory input, right? Is it like, I want that toy and you gave me the red one, like I wanted the blue cup versus the red cup, like that seems more behavior versus like you're in a loud environment and you're having meltdowns because you're not getting what you want. So I think it's multi-layered, but I feel like if it's more of a sensory-based activity that's causing the meltdown, whether it's like too much sound, the touch, the environment, versus like a true behavior when they're seeking something, like if they're giving mom a harder time than they're giving dad, or vice versa. That's more of a behavioral thing versus, the whole operation of brushing their teeth. It just makes them, melt to the floor. That's probably more a sensory processing thing versus a behavioral thing. So it is tough sometimes. So I'm always open to like, talking to other professionals to make sure that we're on the right path.
I just wanted to add a comment. I work with them, or my son does.
You work with me, Coral.
I was really surprised at how much the output of skills, like the gross motor and fine motor, were being limited by the lack of emotional regulation. And JoJo was really great at naming feelings, so I didn't see that as an issue. And then Elizabeth worked with JoJo in the beginning for a long time on emotional regulation, and now he's able to. He has so much more stamina that he's able to do the hard things and make a lot of growth in those fine motor and gross motor. So a learning for me was like how
combined all of the, intertwined all of those skills are.
Yeah.
And then I also wanted to say thank you, to also work with Jamie and how wonderful these providers are. And I say they're like Team JoJo. And with Greentown support, they've made such a transformational difference. So I personally, as a parent and someone who's sensitive, I would highly recommend both of these providers.
Yeah, one of like my favorite slides from like the in-service that we give is like the pyramid of learning. And on the bottom of it is like central nervous system organization, right? So if you have a little racing body and a racing mind, or, you know, you're feeling your feelings really big because you're frustrated because this is hard, like that level of academic learning at the top isn't going to happen because they're just so dysregulated and can't control themselves and really be their best, you know? So, you know, sometimes it takes a while to figure out what is, you know, the underlying issues under the iceberg there, you know? Is it visual motor processing? Is it, you know, emotional regulation, self-regulation to really support our end goal of writing and being a student and everything? So yeah, it does take a process for sure.
I noticed that, thank you all of you, that both groups, nobody like listed diagnoses in any of their presentations, and I'm wondering if that's like a trend that's happening, or how helpful it is to have a diagnosis going forward, or any sort of just, you know, learning disorder.
I think it's, you know, sometimes it's like, you know, children like and families are like on a journey, you know, and it's like, okay, well, what are we seeing? You know, how can we can address these skills? And if we're trying to address the skills, you know, feel free to jump in. We're trying to address these deficits and we're still finding, you know, resistance and challenge. Like we talk as a team to make sure that, are we missing something? Is there something greater than, you know, what we're dealing with? So we tend to, like when there's not like a true diagnosis, like sometimes we're still treating the symptoms of the diagnosis, you know? You know, particularly around the dysgraphia, like, you know, trouble writing and things, like I'm still supporting visual motor skills. I'm still supporting upper body strength and, you know, all and fine motor skills. So I think privately that's more flexible, you know, because, you know, we could use like a generalized code that to give you for your super bill, but
and again, or those kids that don't qualify for OT or speech services, right? So
yeah, like
there's
missed it by a
just,
couple
but they
points.
still need
But they're
assistance,
yeah,
right? Like technically they don't have a diagnosis, but require a plan of care or like benefit.
Yeah, right. And it's like, you know, your parents that like, but they're struggling, or you're getting feedback from, you know, their primary teachers that like, this is really, you know, they're really struggling in this way. And, you know, that's kind of like how we started what we do. It's like, they really need it.
Just wanted to add to that, the diagnosis a lot of it's on the parties. I know, like, is that like the diagnosis a lot is mainly used for billing purposes, and often it doesn't like know one child, like if what they're dealing with often fits into this tiny little package.
Yeah.
So diagnosis is nice for billing, but otherwise, from the private perspective, you're really addressing the problem in the child and trying to figure out where they are.
Right.
It really doesn't matter what the diagnosis is. There are times, I mean, from my perspective, I'll use one just because I know it'll get paid.
Right.
But I might be doing other things too.
Yeah.
It's like not covered because healthcare doesn't care about that.
And I think too, like, versus
like
working with someone privately versus like working with the IU, like sometimes they're very pigeonholed and they're working on like two goals.
Yep.
You know, and they're very functional goals, like holding something.
a lot of it's very academic driven areas.
Whereas like a private therapist, we can work on everything, you know, and generally that's what it is.
You have to have, we have to show that those goals were met versus private where you can be more free and work on this. So there's a difference. Like,
and that was part of
being a therapist.
Insurance.
And she's got into reports and she has to make these goals and they have to be met. But private, I mean, you're still meeting everyone, but private has more flexibility.
Yes, I agree.
Thank you.
Thank you for having us.